No link between COVID-19 vaccines and a sudden death, ICMR and AIIMS. In a major development, extensive studies by ICMR and AIIMS have conclusively ruled out any link between COVID-19 vaccines and a sudden death among adults in India. The Indian Council of Medical Research (ICMR), along with National Center for Disease Control (NCDC), studied cases of sudden unexplained deaths in adults aged 18 to 45. Their finding confirms vaccines are safe and such deaths are more likely due to lifestyle factors, genetic issues, or pre-existing conditions. One study conducted across 47 hospitals shows no increased risk of sudden death after vaccination. A parallel ongoing study by AIIMS also highlights heart attacks and genetic mutations are key causes with no major changes from previous years. Health experts warn that linking vaccines to sudden deaths is misleading and harmful, potentially fueling vaccine hesitancy. The government of India stresses the need for evidence-based public health messaging to maintain trust in vaccination and save lives.